Bone resorption or bone loss is a natural physiologic process where the bone which no longer serves any purpose is absorbed back in the body. Among all the bones in the body, the jawbone is the most affected. Bone remodeling is the constant process of building and breakdown of the bone in the body. Osteoclasts are the bone cells that break down the bone and return its minerals to the blood. Osteoblasts are the bone cells that build up the bone using the body's resources. At young age, the osteoblastic activity is more than osteoclastic activity, leading to strong bones, whereas, as the age advances, the osteoclastic activity becomes more than the osteoblastic activity, leading to weaker bones. Bones are usually strengthened by any physical stimulus it receives in the form of biting and chewing. When there is a tooth loss due to extraction or trauma, the stimulus to the dental bone is lost. As a result, the body signals to increase the osteoclastic activity at the site of tooth loss, leading to destruction of breakdown of the jawbone. The osteoblastic activity still continues, but at a lower rate, thus leading to bones resorption or bone loss. The probable causes of bone resorption include reasons imbalance the osteoclastic and osteoblastic activities, including tooth extraction, tooth trauma, gum disease or periodontitis and osteoporosis. The bone's resorption usually occurs at two sites. External resorption develops on the exterior of the tooth in the site where the tooth connects to the jawbone. It can manifest as pink spots around the tooth on the gums. Internal resorption occurs within the tooth and can result from chronic inflammation in the tooth's pulp. Dental bone resorption, although a slow process, can eventually result in denture not fitting well. There may be an inability to place the dental implants as sufficient bone may not be available. These could lead to visible changes on the face, such as the lips and cheeks could sink in. The treatment of dental bone resorption depends on its underlying cause. For resorption related to tooth extraction, the dentist may choose to place a dental implant immediately after tooth extraction. The implant tends to provide stimulus to the bone for proper balancing of osteoclastic and osteoblastic activity. For the sites that have already been resorbed, bone grafting may be considered. Bone resorption happening as a result of osteoporosis usually needs systemic treatment with medications or hormone therapies. If periodontal disease are the cause of bone resorption, scaling, root planning and antibiotics may help treat it. For advanced periodontitis, flap surgery, soft tissue or bone grafts, and tissue regeneration may be considered. To prevent resorption of dental bone, one should follow a healthy balanced diet to prevent nutritional deficiency. Prompt treatment should be sought for dental trauma or gum disease. Practicing oral hygiene goes a long way in maintaining gum health and preventing bone loss. Timely and appropriate treatment should be planned after tooth extraction to prevent resorption. Any systemic disease that could affect bone remodeling should be treated. The most effective measure is to go for regular dental checkups to help diagnose dental problems early and get prompt treatment.